Hi, folks. This is Dr. Rob Cywes here, the CarbAddictionDoc, and I wear many hats. Most of you know that I'm actually a practicing clinical surgeon. I am a board-certified general surgeon and also a board-certified pediatric surgeon. So I can operate on babies from basically -9 months all the way through to just before death. That's the human species I am certified to operate on. Now, what we're going to talk about today is preparing yourself for surgery. Whether it's major surgery or minor surgery, any surgery that gets done on you, be it cosmetic surgery, be it a liver transplant, a heart transplant, be it having a baby, any surgery, is ultimately seen by the body as a massively traumatic event. And there are a lot of shifts that happen in that body. Nutrient shifts, fluid shifts, activation of the immune system. A lot of things happen in the body. And the body needs all of its resources to heal quickly, to heal effectively, and to prevent infection, inflammation. And on top of that, you kind of want to make your surgeon's job as easy as possible. Because as a surgeon, if my job is easy, your outcome is likely to be straightforward as well. If my job is made complex by what you've done to yourself, then that complexity affects the quality of the surgery that we do. And we've got to understand that you want to give your surgeon the best canvas to do his or her work on. And there are certain things that we can definitely impact on. And the most important things are the degree of that we've activated in a bad way our inflammation system, our inflammatory system, the size of our liver, and the ability of the liver to deal with the complex changes that occur around surgery, especially getting rid of fatty liver. And then the final thing is getting rid of sugar and the massive fluctuations of sugar. We know that diabetes is an awful condition for sick people. It makes the illness and the recovery so much worse. You know, a guy by the name of Stephen Tucker, who's a physician out in Singapore, gave a great presentation at the USA Low Carb USA conference, and he said something that really was eye-opening for me. In women who have breast cancer, who are able to put that breast cancer into remission, some people stay in remission forever, and some people, the disease recurs. And he said something very interesting. A ketogenic diet and fasting is the single best way to incur remission. And yet, he has never seen a diabetic person, not have that recurrence. Wow, that was mind-blowing to me. The diabetes is most closely associated. It's the single most closely associated factor with recurrence after remission. But that's also true for surgery. The sickest patients we take care of are the patients who are insulin resistant and diabetic. And the two are slightly different because insulin resistance can result in metabolic syndrome or obesity or diabetes. But look at the COVID patients. They're suffering more because of that insulin resistance. And at surgery, the most difficult patients to manage are patients who are insulin resistant or actively diabetic. In fact, one of the bizarre things that we've done recently is we're on purpose giving a lot of our patients a bottle of Gatorade to drink 4 hours before their surgery to bump up their sugar levels so that they don't crash and burn during the surgery because they've got to fast. We used to fast for 8 hours, now we fast for 4 hours, at least with liquids. And we do that on purpose. Like in the old days, we used to give an alcoholic some whiskey before surgery so they wouldn't go into withdrawal. Now we're giving people sugar before surgery so they won't go into withdrawal. Boggles my mind. But here's the best thing you can do in preparing yourself for surgery. If you know you're going to have elective surgery, a week, 10 days out, even 5 days out, but the longer the better, go pure keto even if it's carnivore, but I don't care if it involves vegetables. But get rid of the sugar and the starch in your diet. And simply put, that's going to do several major things. Number one, it is very rapidly going to dampen down your overactive immune system very quickly. Number two is it's going to radically lessen the excess amount of fluid you're carrying. Sugar holds onto fluid, you diurese, and if your tissues are less waterlogged, they're easier to cut through, they're easier to operate on. Number three is within 48 to 72 hours of no carbohydrates or ultra low carbohydrate diet, you can get rid of a fatty liver completely. And a small healthy liver is your best metabolic advantage going through surgery. And number four is if you flatten your blood sugars by getting into ketosis, you don't even have to be fat adapted. That ketosis, that stable blood sugar, can allow you to tolerate the NPO status, the non-consumption status that surrounds most surgeries, where you're going a long period of time without taking energy in because you've got tons of fat to burn. Unless you're an Olsen twin, unless you're Urkel, you've got a ton of fat to burn. But if you can't access it because your insulin is high and you're in glycosis, not in ketosis, that fat is useless to you as an energy source, and then they have to give you sugar in your veins, which is going to make you diabetic, which is going to make you sicker. But you can live an endless amount of time nearly on the amount of fat that you have, especially if you're the average modern American. So if you can get yourself into ketosis before your surgery, you're doing yourself and your surgeon the single best favor you can do. You're optimizing your own health. And if you're going through surgery and you know it's coming up, give us a shout. Do one visit with us. We can give you our dietary format, and it's not difficult to do. All of my elective patients are placed on our special diet. And particularly if we're operating in the foregut, if we're doing liver surgery, if we're doing gallbladder surgery, if we're doing stomach or esophageal or pancreatic surgery or splenic surgery or kidney surgery, getting that liver out of the way, getting that liver shrunken down makes all the difference in the world. That's where I live. I live in this part of the world. Operatively, of course. You have no idea. You have no idea the night and day difference that makes to me as a surgeon. And if my life is good, your outcome is probably going to be good. And it's not just for me, it's for any surgeon. Your surgeons may not share that with you. You know better than they do about metabolic safety, metabolic security. If you can go into surgery metabolically secure, you reduce your risk radically, irrespective of the surgery. And if you can actually go into that surgery fasting for 48 hours, just non-calorie containing liquids with a lot of electrolytes and salt. In other words, abstaining from carbohydrates, eating as much as you want to, but abstaining from carbohydrates for a minimum of 7 to 10 days. And then the last 48 hours before the surgery, just going pure sugar-free fluids with tons of salt and tons of electrolytes. You're going to give your surgery the best canvas to do his or her painting on. And the outcome will be of benefit to you. And then one final thing, if that is what you have done, make sure that your anesthesiologist and your surgeon do not write for dextrose-containing fluids afterwards. It boggles my mind that we still give the sickest patients sugar in their IVs. But I guess we're treating a bunch of sugar addicts. And what do we treat sugar addicts with? Sugar. And we make them sicker. Control your own outcome as best you can. Go carb-free, do intermittent fasting for 2 to 3 days before your surgery. This is what I've done in practice with my own patients for 21 years. And it works, folks. It works. Help the doc. If this discussion has resonated with you and you are interested in how we prepare our patients, set up a short visit. It doesn't take long. Okay? Set up that visit by texting 561-517-0642. or reach out to me on Messenger, on Facebook, through our Instagram account at CarbAddictionDoc. But if this video has resonated with you, throw a few dollars at us so we can make more and more of this free content. But folks, it works. It works. I've got thousands of patients that are the proof that this works. And I can tell right away, as soon as I look inside a person's belly, as soon as I look in their belly, I can tell right away when they followed what we asked them to do or not. Take control of your own health. Prepare yourself for surgery, irrespective of whether you're having a haircut or your toenails clipped or anything in between. Be smart. Take care.